Hospitals across the country are trying to make up for lost workers by offering incredible incentives to new hires. In Michigan, Beaumont Health is offering a $10,000 sign-on bonus to registered nurses. And in Port Huron, Tri-Hospital EMS is paying double time for EMT workers while they work on filling 10 openings. Tri-Hospital EMS President and CEO Ken Cummings joins us now. Good morning to you, Ken.
Hi, Ainsley. Great to be with you.
Great to have you. I know that you've lost 10% of your workforce. Why is that?
Well, I think it's a combination of a number of factors. Normal attrition. We typically have a turnover rate in our organization around 8% annually. That's gone up a little bit. But I think the real issue more than anything else is EMS workers are getting tired. The wages are not very good. They haven't been good for many, many years. And so people are choosing different career paths to pursue, and they're leaving the EMS field.
Why aren't they making more money? They're saving lives.
You know, it's been a long-standing problem with EMS. The staffing shortage that we experience right now really didn't begin just because of COVID. It's been building for a number of years, and really it's been the result of just incredibly inadequate funding from the payer sources that are used to fund EMS services across the country. Payer sources have just been historically low for ambulance services, and that translates into very low pay, unfortunately. And so we typically have a fairly high turnover rate in this industry.
How is that affecting the 911 calls? Are you seeing delays?
You know, we are not seeing any delays in my market right now. However, being down 10% of our staff, we've been able to backfill some of these vacant positions with other employees working overtime, with management staff. But I will tell you, there are certainly delays occurring throughout our state here in Michigan, as well as across the country right now. I think organizations are being forced to prioritize the calls. Choosing to respond to the more critical cases first, forcing the other cases that may be less critical to wait for the availability of resources.
Would you call this a crisis?
I think it's absolutely a crisis. We definitely need our elected officials to step in and provide some assistance. I believe the pathway out of this is getting some additional funding so that we can increase these wages and draw more people into the industry, as well as keep the people that we have right now. If we don't do this, we're facing a serious crisis and shortfall of EMS workers across our country.
Well, Ken, I mean, they basically all were working in a petri dish of COVID, and so we thank y'all all for everything you've done over the last few years, especially to just keep us all safe and take care of all of us. I hope that the problem is looked at by your governor and they really focus on this.
Thanks, Ainsley. I appreciate that.
You're welcome. Thank you, Ken.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.